was telling that this image was asked that the male patient is having a pus discharge. So this is a urethritis. We discussed about the gray kit. If a male patient have a urethral discharge, he should be treated for the 2 bacteria. We will suspect the Neisseria. We will suspect that this patient might be affected with the chlamydia. So we will use this gray kit. So yesterday we discussed on this gray kit. So remember, Neisseria was the urethritis like this. So कल हमने देखा था tinea versicolor. What is the positive agent of tinea versicolor? Tinea versicolor. मलासेसिया ग्लोबोसा. क्या था वो डिजीज? मोस्ट कॉमन क्या था? हाइपोपिगमेंटेशन. पेटिरियासिस वर्सिकुलर क्या करता है? मोस्ट कॉमनली हाइपोपिगमेंटेशन. ऐसे छोटे छोटे व्हाइट पैच फिर बड़ा पैच. क्यों होता है ये? बिकॉज फंगस क्या सिक्रेट करती है? फंगस सिक्रेट करती है एजेलिक एसिड. It will inhibit the enzyme tyrosinase, right? इसकी वजह से क्या हो जाएगा? Hypopigmentation, which is a most common finding. But I told you, if the person is a fair skin person, so as you can see, if this person is a fair skin, so he can have a hyperpigmentation. Which medicine is not used in tinea versicolor? Griseofulvin and terbinafine is not used. हम क्या यूज करेंगे टॉपिकली? क्लोट्राइमाजोल यूज करेंगे. We can use fluconazole, iconazole also, right? What is the causative agent of the pityriasis rosea? What is the causative agent of the pityriasis rosea? Students who are online also can interact. Pityriasis rosea, what is the causative agent? Human herpes virus 6 and 7. हमने बात की थी क्या था? हेराल्ड पैच और मदर पैच. हेराल्ड पैच और मदर पैच था ना, कल बात की थी. Which pattern you will see? Herald patch and mother patch? Christmas tree pattern. You will see that lesion is spreading all over the body in a pattern of a Christmas tree. So as you can see, this was the finding, Christmas tree pattern. So see these are the red erythematous rash. And what was the scale giving me the sign? A hanging curtain sign. What was this sign? Hanging curtain sign. So pityriasis versicolor is a red erythematous rash, right? Versicolor means hyper and hypopigmentation. Rosea means red color rash. Rosea means red color rash. What is this sign? Groove sign. Groove sign. Can you appreciate the two groups of lymph node are involved and ligament is passing by? Groove sign. What will the patient will develop? Genital elephantiasis, right? Which disease? Lymphogranuloma venerum. What is the treatment? डॉक्सी. कितने दिनों के लिए? 21 days के लिए. We will give doxy 100 mg twice daily for 21 days. Suppose this lymphadenopathy is because of the chancroid. If it is because of the chancroid, what is the causative agent of the chancroid? The causative agent of the chancroid is a Haemophilus ducreyi. ducrei always makes you cry. Painful ulcer, painful lymphadenopathy. Hemophilus ducrei. What is the drug of choice? Drug of choice is a azithromycin. You just have to give one dose, which is 1 gram. So these two diseases, now you recollect this material, that if I ask you inguinal bubo syndrome, in inguinal bubo syndrome, which kit is used? Black color. Green is for the girl. Green for the girl, vulvovaginitis. Black kit is for the boys. It will cause inguinal bubo. In which disease you will see the pseudobubo formation? Donomanosis. What is the causative agent of the donomanosis? Klebsiella granulomatosis. Klebsiella granulomatosis. Okay. We will discuss dermatomyositis. Important 3 signs of the dermatomyositis. It is an autoimmune disorder. It is an autoimmune disorder. The first sign is a heliotrope sign. What is this sign? This sign is a purple erythema on the upper eyelid. Purple erythema on the upper eyelid. This sign is a pathognomic. This sign is a pathognomic of the dermatomyositis. Second sign is a shawl sign. So what you will see? A fixed erythema. Fixed erythematous rash on the chest and the upper back. Second is a Gottron's papule. Gottron's papule. This is also known as a mechanic hand due to erythematous papules on the knuckles. Erythematous papules on the knuckles. So this heliotrope sign, among all the signs, heliotrope sign is a pathognomic sign. Heliotrope sign is a pathognomic sign. As you can see, what is the pathology here? Dermato and the myositis. So skin and the muscle involvement. Skin plus muscle involved. Patient will have anti-Jo1 antibody. Anti-Jo1 antibody can be helpful in the diagnostic. So let's see these signs. First of all, see this heliotrope sign. So what we wrote, this is a pathognomic sign of the dermatomyositis. in dermatomyositis, you will look for the red erythematous rash of the upper eyelid. Okay, this is a red erythematous rash of the upper eyelid. This is a my heliotrope rash. This is a heliotrope rash. Second is a, as you can see in this patient, because of the skin inflammation over the knuckle, I have a small papules on my knuckles. So it looks like the patient is a mechanic or a heavy worker who having a erosion on this hand. So this sign is a known as a mechanic hand sign. And this small papule which is seen is a Gottron's papule. It is a Gottron's papule. Second image, if you can see here, this is the shawl sign. So why the shawl sign? It's like that a female was wearing the shawl, and when she goes out, she developed the sunburn on the unexposed area. So that is why this sign is known as a shawl sign. Because of the skin inflammation, because what I told you, what is dermatomyositis? Dermatomyositis is an inflammation of the skin and muscle. In this patient, actually there is an inflammation here because these are the proximal muscle area. Because of the skin involvement, there is a redness, and that is why it will give me a shawl sign, which is a sign of dermatomyositis. Now see this image. Moving to the next. The patient developed this rash after taking the drug. In your image, if you can appreciate, there are multiple zones in this rash. Okay, so because of the multiple forms which are red erythematous, this rash is a red erythematous, and because there are multiple forms, ring forms, these lesions are known as a erythema multiforme. Multiple types of the erythematous rash present on the body. So if you can appreciate here, clearly there are three different zones. In the center, there is more red erythema. In the outer part, there is less erythema. Can you appreciate? Sorry? Crest? क्या बोलेंगे? क्रस्ट? नो क्रस्ट तो कब होगा? जब पस ड्राई हो जाएगा उसको हम क्रस्ट कहते हैं. क्रस्ट इज अ ड्राइंग आउट ऑफ द पस, देन वी विल टेल इट इज अ क्रस्ट. यहां पे तो क्या हो रहा है? इट इज जस्ट अ एरिथेमेटस रैश, एरिथेमा मल्टीफॉर्मे. व्हाट इज द मोस्ट कॉमन कॉज ऑफ द एरिथेमा मल्टीफॉर्मे? This MCQ has been asked. Most common cause is a idiopathic. क्या? नहीं टॉपिक है ये, अलग से डिजीज है, टॉपिक है. पर तीन साइन ही है डर्मेटोमायोसाइटिस. डर्मेटोमायोसाइटिस का स्टेरॉइड्स ऑटोइम्यून डिजीज है, स्टेरॉइड्स देंगे. हाँ, ऑटोइम्यून डिजीज. एरिथेमा मल्टीफॉर्म में एक ड्रग रिएक्शन है. मोस्ट कॉमनली इस पे पूछते हैं व्हाट इज द मोस्ट कॉमन कॉज ऑफ द एरिथेमा मल्टीफॉर्म. इफ दे आस्क व्हाट इज द मोस्ट कॉमन कॉज which is infectious, okay, now if they are making the MCQ like this, what is the infectious cause of the erythema multiforme, then answer will change that viral infection can cause more than bacterial infection. Virus which can cause erythema multiforme is a herpes simplex virus. Bacteria which can cause erythema multiforme is a mycoplasma. So herpes simplex virus and the mycoplasma. ड्रग्स कौन सी देंगे which can cause this drugs causing? These are the anti-malarials and the sulfonamides. Anti-malarial and the sulfonamides. Erythema multiforme, it is a type 4 hypersensitivity reaction. It is a type 4 hypersensitivity reaction. Sometimes it shows Koebner phenomena. In some cases, okay. In some cases, you will see that Koebner phenomena is seen. हमने लाइकेन प्लेनस के साथ इसका नाम लिखा था. What was the feature? Interface dermatitis. डर्मेटोलॉजी में दो ही डिजीज को याद रखना है, which cause interface dermatitis. एक एरिथेमा मल्टीफॉर्म में याद कर लो, दूसरा है लाइकेन प्लेनस. Interface dermatitis. On a histopath finding, interface dermatitis. So if I ask you what is the bacterial cause of the erythema multiforme? Mycoplasma. Though it is less common, but bacterial cause is mycoplasma, viral cause is HSV, and most common is the idiopathic. Most common is idiopathic. Chalo. See this. Patient was on anti-epileptic medicine, lamotrigine. Lamotrigine is a anti-epileptic drug. Patient developed this rash. As you can see, there is an extensive loss of the epidermis, right? So, yes, it is a toxic epidermal necrolysis. Why it is a toxic epidermal necrolysis? Because more than 30% body surface area is involved. Okay. So see this. This is also known as a Stevens-Johnson syndrome. This is also known as a Stevens-Johnson syndrome. I'll show you the photo. So what is the Stevens-Johnson syndrome? The disease both are the same, but the only body surface area which are involved is different. Both is usually caused by the drugs. So this is a Stevens-Johnson syndrome and the toxic epidermal necrolysis. But remember, they commonly use short form of this, so you should know. I have seen directly in examination they write SJS or a TENT. Okay. It is commonly caused by the drugs. Which are these drugs? These drugs are anti-epileptics. These drugs is anti-epileptics. The commonly which can cause is a lamotrigine. Lamotrigine. Sometimes NSAIDs and the sulfa drugs. Sulfa drugs can cause this. The lesion will have a targetoid lesion. Targeted lesion will be present initially, which has a two zones. targeted lesion with the two zone. Now see this, if only less than 10% body surface area is involved, the syndrome is a Steven-Johnson syndrome. Mostly oral mucosa is involved. So in less than 10% body surface area, oral mucosa is most commonly involved. 10 to 30% body surface area. So during this time, you can say both these diseases is present, but if more than 30% body surface area, it is a toxic epidermal necrolysis. And if this develops, the drug of choice is a IG. The drug of choice is the intravenous immunoglobulin. When you have a SJS or the overlap, you can start with the high dose steroid. You can start with the high dose steroid. And always remember, mucosa is always, because when there is a less than 10% body surface area is involved, mucosal involvement start from the SJS only. Okay, so you will see a prominent mucosal involvement. You will see prominent mucosal involvement. Okay, फटाफट बैक्टीरियल डिजीजेस पढ़ेंगे. Bacterial skin diseases. First is the impetigo. The first is the impetigo contagiosa. So since last 2-3 years they have been asking this, right? As a one-liner and image, both has been asked. Honey-colored crust and this image was given. Okay. So it is a impetigo contagiosa. The first variant is a non-bullous variant. The first variant is a non-bullous variant. It is caused by the Staphylococcus more than Streptococcus. Staphylococcus more than Streptococcus, and it is the commonest skin infection in the children. It is the commonest skin infection in children. Most common site is the face. Person will develop a flaccid blister. Then he will develop pus on it. And when it is dry out, it will give me honey-colored crust. Complication child can develop is a PSGA. If it is a strap, topical mupirocin cream. Okay, so see this topical mupirocin can be helpful. Topical mupirocin. Which oral drug which is effective is a decloxacillin. Decloxacillin. Okay, ये हो गया non non-bullous. Non-bullous. There was no any formation of the bulla, right? Second variant can be the bullous impetigo. So हमने already बात की कि भाई Staphylococcus aureus is produce one toxin which is a epidermolytic toxin. Epidermolytic toxin. This epidermolytic toxin damages desmoglein 1. It damages desmoglein 1. And because of this, person will develop a fluid-filled vesicle. Patient will develop a fluid-filled vesicle. And then later on, at the surface of this vesicle, because it is a bacterial condition, there will be the accumulation of the pus. So what you will see in this vesicle you will notice fluid also and pus also. So this sign is known as a hypopyon sign. You will notice that the hypopyon sign. What was the location of this blister? Below the stratum corneum. It is a this blister is a subcorneal blister. This blister is a subcorneal. If this epidermolytic toxin enters the blood, what will happen? There will be the systemic scalded skin syndrome. So staphylococcal scalded skin syndrome. So systemic manifestation patient will have. And this systemic manifestation is known as a Ritter's disease or a staphylococcal scalded skin syndrome. This is known as a Ritter's disease or a staphylococcal scalded skin syndrome. The patient will have a generalized superficial blistering disorder. You will notice the scaling of the skin all over the body. Will you see the mucosal involvement in this disease? Damages mainly due to the desmoglein 1. Damages to desmoglein 1. So no mucosal involvement. What about the Nikolsky sign? Nikolsky sign positive. Okay. Next is a ecthyma. So see this, what is eczema? Generally, if you have any secondary capsule or a skin trauma, what will happen if it is getting infected with a staphylococcal or streptococcal? You will see that because of the secondary infection, a black color scab, which is very hard, is formed on a primary wound. This is known as a eczema. So खाली causative agent जानना है. Eczema क्या है? What is thick? It is a thick adherent. It is a thick adherent crust due to infection it can be the staphylococcal, it can be the streptococcal. Seen in mainly in the diabetic or person with the poor hygiene, because it is a secondary infection. Now do not get confused if they in your exam, if they ask eczema, gangrenosum. So anyone knows what is the causative agent of eczema gangrenosum? It is a Pseudomonas aeruginosa. It is a Pseudomonas aeruginosa. See this. So this patient is coming to me that, doctor, I am having a red erythematous rash in my axilla. So when I do the wound length examination, on a wound length examination, what I'm seeing a coral red color on a wound length examination. What is the disease? This is a erythrasma. Okay, erythro means red color, right? Red color is discoloration, is the erythrasma. So what you will see, it is a well-defined erythematous rash. It is a well-defined erythematous rash in the intertriginous area. In the intertriginous area. Two important MCQ. It is caused by Corynebacterium menuissimum. Second MCQ they ask, on a wood lamp, it gives me coral red. It gives me coral red appearance. So underwater sea में ऐसे दिखता है ना, because of the light being transparent, it is a coral red appearance. It will give me a coral red appearance. Right? Intertriginous मतलब area of friction, axilla हो गया, perineum हो गया, these are those. So intertriginous area is commonly axilla and the perineum. So if these two area with a red erythematous rash has been given, then you will suspect the erythrasma. You will suspect erythrasma. Okay. एरिजिपेलस खाली पॉजिटिव एजेंट याद रखना है क्योंकि आपको कंफ्यूजन ना हो. एरिजिपेलस क्या है? इट इज कॉज्ड बाय द बीटा हेमोलाइटिक स्ट्रेप. बीटा हेमोलाइटिक स्ट्रेप ग्रुप ए. What you will see? Erythematous rash with a tender margin. Erythematous rash with a tender margin. Okay. Now, what is this rash? Erythema marginatum. एरिथेमा मार्जिनेटम. यार ये रेस तो सुना होगा आपने, एरिथेमा मार्जिनेटम. इसमें acute rheumatic fever. It is a rash of acute rheumatic fever. It is a rash of acute rheumatic fever. प्रीवियस स्लाइड में वही लिखा है, खाली एरिजिपेलस को लिखा है. Erysipelas, erythema marginatum. It is a rash of acute rheumatic fever. Positive agent तो वही हुआ. Group A beta hemolytic step, right? Group A beta hemolytic step. See this purpura fulminans. So what is this purpura fulminans? You will notice that there is a subcutaneous large bleeding. Okay, ecchymotic bleed you will see. This is a sign of a meningo. This is a sign of a meningococcemia. This is a sign of meningococcemia. It is a sign of meningococcemia. Purpura fulminans. What was the cause of acute candida? Acute paronychia. Sorry. Acute paronychia. Acute. Two kinds of paronychia was there. Acute and chronic. Acute is caused by Staphylococcus aureus. If I ask you chronic paronychia, it is a candida. Okay, so this is just a revision because we already discussed Staphylococcus in a detail. The causative agent of the bacteriomycosis was the Staphylococcus aureus. Have you heard toxic shock syndrome? It is also Staphylococcus aureus. Most commonly, toxic shock syndrome is seen in a menstruating females because when the pets get infected with this bacteria, it will release toxin which will cause shock. So they will give you this typical history which shows toxic shock syndrome. The other syndrome we discussed, scalded skin syndrome, staphylococcal scalded skin syndrome, right? Now see this. The patient is having a strawberry tongue, as you can see, right? So, जब स्ट्रॉबेरी टंग आती है तो दो डिजीज याद रखेंगे, कावासाकी डिजीज एंड द स्कारलेट फीवर. दो डिजीज में होती है स्ट्रॉबेरी टंग. बट यहाँ पे दूसरी जो दो साइन है, यू सी दिस रैश इज अ सैंड पेपर रैश. ओके. And what is this third sign? On the flexure area, I will have a red erythema. So if you can notice, Here I have a more red erythematous rash. This child is having a on the flexure area red erythema. These line are known as a Pastia's line. So scarlet fever की तीन finding याद रखनी है. Scarlet fever. This first is a sandpaper like rash. Then strawberry tongue. Strawberry tongue. And Pastia's line. So you can remember like this. It is a flexure erythema. It is a flexure erythema. What is the causative agent of the scarlet fever? It is a because of strep person can have a strep pharyngitis. Person can have a strep pharyngitis. Okay. So ये हो गया. टीबी पढ़ेंगे. टीबी स्किन. टीबी स्किन. So you all know TB is prevalent in India, right? So when you will start working here, many patients will come into your contact also. So when you develop immunity, you will develop immunity only after the exposure, right? So if you do not have immunity, what will happen? If you coming into contact, the first time you will develop the disease, right? But the second time you might develop a proper immune response against it. So what is happening in TB skin? So how on my skin this bacilli can come? Most commonly when we are working with the patient and sometimes the patient's secretion come into our skin contact. Most commonly anatomist or a pathologist who are doing the dissection. And suppose the dead patient had a pulmonary TB, and if the person is taking a biopsy from the lung, what will happen if he is not wearing the gloves? He will come into the contact. So let's make a concept that if no exposure, it means this person is having a poor immunity. If no exposure means poor immunity. So let's take an example, the first exogenous variant. So when my body is having an exogenous exposure with the TB bacilli, what will happen? I will develop a tuberculous chancre. I will develop a tuberculous chancre. So what is the meaning of tuberculous chancre? Suppose this is my skin. On my skin, I had an exposure of this bacilli. But because I do not have an active immunity present, what will happen? This bacilli will increase in the number and it will cause chancre or the ulcer. So what happened to the number of TB bacilli? Number of TB bacilli increased. So can I say this disease is a multibacillary? right? Bacilli is increased. So it is a multibacillary disease. So this patient had a first exposure. Now somehow immunity tackled it, but after many years, this same patient, this same patient had now has a second exposure of the bacilli. Now he again came into the contact, but now because of this previous exposure, patient is having a strong immunity. Patient is having a strong immunity. So what will happen? My immune cell, you all know in pulmonary TB, how you kill this bacteria? TB? In pulmonary TB, how you kill the TB bacillus? By forming the granuloma, right? That is why in pulmonary TB patient, they form cavities. In pulmonary TB patient, what you see? They have a large cavity after the treatment. What is the reason? How this my immunity will work? My immunity will make a granuloma and make a granulation tissue. So what is this granulation tissue? To limit this bacilli. So can you see the number of bacilli is decreased because of my strong immunity? Bacilli is decreased due to strong immunity, and because of this disease is known as a bacillary. And because of this TB got the name Warty TB. Warty TB. Or the tuberculosis varicose cutis. तो देखो खाली इसमें अगर आपको याद खाली इतना ऐसे रखना है, प्राइमरी एक्सपोजर, पुअर इम्यूनिटी, बैक्टीरिया बढ़ जाएंगे, अल्सर कर देंगे. In the next, I have a strong immunity. So what I will do? I will decrease the number of. How I did it? By forming the wart and the granuloma, and that is why secondary TB is known as a Warty TB. Secondary TB is known as a Warty TB. Now you all know bacteria and viruses, are they intelligent or no? They are intelligent. So when we developed penicillin, our penicillin was effective against bacteria, but nowadays penicillin is not effective. Why? They made enzyme to kill our drug, right? So this is what I talked about in this primary and secondary, that how my immune system will work. So if I will show you the photo, see this. This is the photo of the tuberculosis chancre. So when this patient had a first exposure, this bacilli number increased, but somehow my immunity knew how to fight this bacilli, and patient get resolved and treated. But now, because my immunity now knows how to kill this bacilli, when he had a second exposure, you see how large wart. Why this wart is so large? The reason is my immunity is killing them and making the granulation tissue. तो अगर ऐसे फोटो आती है तो it is a Warty TB secondary exposure. What you will remember? Pauci bacillary. The disease is a Pauci bacillary. But अब क्या हुआ? This bacteria also knew that his immune system is forming the granuloma. Now they will find a way how to escape the granuloma. So see this, we will understand like this. Suppose this is the same skin. First of all understand, then we will write because it is the most common. Now I am having the exposure. I have an immunity present. I have an immunity present. But in this, when I try to form the granuloma, when I am trying to form the granuloma, this bacteria is escaping the granuloma and going into the nearby skin. So again and again, I am forming the granuloma and again it is escaping. So again I will form the granuloma and try to limit this. So by doing this, it will happen. These all will become a patient's skin. And in this patient, what you will see, you see this first skin. So my body is forming the granuloma to cover the bacteria, but underlying वो escape कर रहा है, तो वापस से नई स्किन को एक्सेप्ट, इम्यून सेल वापस से जा रहा है, वापस से कवर करते 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 पेशेंट की फेस क्या होगा, पूरा भर गया रेड से. द रीजन क्या है, escaping of the granuloma. तो ये जो फाइंडिंग है, this is known as a lupus vulgaris. This is known as a lupus vulgaris. So हम लिखेंगे this type of escaping, this is known as a lupus this type is a lupus vulgaris. So what is the peculiarity? TB try to heal at one end, TB try to heal at one end and then spread hematogenously. Then spread hematogenously. हमने डायस्कोपी का एक फाइंडिंग लिखा था पहले. If you remember, in a diascopy, apple jelly nodule लिखा था हमने, right? So this is the important MCQ. If I see in a diascopy, it will give me the apple jelly nodule. It will give me the apple jelly nodule appearance. Lupus vulgaris is the most common type of TB in India. But this is for the adults. Most common type of TB in India in adults is the lupus vulgaris. Lesions fills with a lesion will heals with the central scarring. तो यहाँ पे हम याद करेंगे सेंट्रल एट्रोफी किसमें थी, सेंट्रल एट्रोफी डिस्कॉइड लुपुस एरिथमेटिस, सेंट्रल क्लियरिंग टीनिया वर्सिकुलर डर्मेटोफाइटोसिस. यहाँ पे आया सेंट्रल स्कारिंग. सेंट्रल स्कारिंग होगी तो क्या होगा, इट इज अ लुपुस वल्गारिस. सेंट्रल स्कारिंग लुपुस वल्गारिस. Miliary TB the most common form in the HIV. If the patient is having a HIV, miliary means all over the body. But if they ask what is the most common TB skin in the children, answer is a scrofuloderma. It is a scrofuloderma. So what is the scrofuloderma? It is not an exogenous spread, it is the endogenous spread from the lymph node affected in the TB. So scrofuloderma बच्चों में दिखता है. So if the child is having a pulmonary tuberculosis and he is having a cervical lymphadenopathy, so what will happen after the swelling of the lymph node? When this lymph node will open up, it will ooze the bacteria out and it will infect the skin. So see this. So if you can see, there is a swelling of this lymph node. So this person is having a TB lung, but along with the TB lung, he is having a lymph node which is opening up outside and it will cause endogenous spread. So what is the name of the endogenous spread of the TB? Scrofuloderma. And this scrofuloderma is the most common in children. See. We already wrote the fish tank granuloma. What is the causative agent of fish tank granuloma? Mycobacterium marinum. Drug of choice minocycline और azithromycin. Marinum से M याद रखो. Marinum है minocycline drug of choice. पेशेंट का प्रोफेशन क्या दिया हुआ होगा? That फिश में काम करता होगा या ऐसा होगा. कौन से डिजीज से रिसेंबल करता है ये? Rose Gardner's disease, right? What is the causative agent of Rose Gardner's disease? Sporothrix shanghai. उसकी बॉडी का नाम क्या था? एस्टेरॉइड बॉडी याद रहेगा. ड्रग ऑफ चॉइस स्पोरोथ्रिक्स शंघाई, इट्राकोनाजोल. तो वापस से रिपीट करें. स्पोरोट्राइकोसिस फंगस, स्पोरोथ्रिक्स शंघाई, राइट? रोज गार्डनर्स डिजीज, एस्टेरॉइड बॉडी, ड्रग ऑफ चॉइस इट्राकोनाजोल. फिश टैंक ग्रैन्युलोमा, प्रोफेशन क्या दिया होगा? एक्वेरियम में काम कर रहा है, फिश के साथ काम कर रहा है. एटिपिकल माइकोबैक्टीरिया. एटिपिकल माइकोबैक्टीरिया में कल दो बताए थे. माइकोबैक्टीरियम आवियम कॉम्प्लेक्स होता है और माइकोबैक्टीरियम मारिनम होता है. रिफॉर्मेशन इसमें आंसर नहीं देंगे. ड्रग ऑफ चॉइस माइकोबैक्टीरियम आवियम कॉम्प्लेक्स की होती है एजिथ्रोमाइसिन. यहाँ पे हम मिनोसाइक्लिन और एजिथ्रोमाइसिन दोनों ले सकते हैं. Disease है fish tank granuloma. So ये MCQ आएगा. Drug of choice for the fish tank granuloma. So rifampicin pyrazinamide नहीं सोचेंगे, हम सोचेंगे minocycline देंगे because it is a atypical mycobacterial infection. Okay, coming to the leprosy. Okay, so see this. In leprosy, it doesn't involve. क्या आंसर करोगे? आंसर इज अ सेंट्रल नर्वस सिस्टम. सो फर्स्ट फटाफट लेप्रेसी के बारे में सोचते हैं. व्हाट इज अ बैक्टीरिया व्हिच कॉज लेप्रेसी? माइकोबैक्टीरियम लेप्रे. Mycobacterium leprae. This is a very ancient disease. भगवान बुद्ध ने लेप्रा के पेशेंट को देख के संसार का त्याग कर दिया था. पता है ना? भगवान बुद्ध when he saw, he was a king, no? So he was roaming in his town as a king, and he came to know that this patient is suffering from the leprosy. In leprosy, and because of the leprosy, it's so severe disease, he understood that I should renounce from this world, because many patients in that area was suffering from the leprosy, very contagious disease. Because what will happen, it will start eating your hand and everything. Once they are increasing the number, they will eat up all your hand and everything. It is a contagious disease. So we will discuss. Generally, they are not able to infect us. They are generally not able to infect us because they grows at कोड नहीं है, कोड तो बेटे लिखा है। तो कुष्ठ रोग है, कुष्ठ रोग है, हिंदी में कुष्ठ रोग कहते हैं। हाँ, हिंदी में कुष्ठ रोग है। सो सी दिस, चलो ठीक है, सुनो अभी माइकोबैक्टीरियम लेप्रा, सी दिस माइकोबैक्टीरियम लेप्रा grows at 30 degrees Celsius, grows at 30 degrees Celsius. And what is the doubling time? Doubling time is 11 to 13 days. बाकी सारे बैक्टीरिया का लैग फेज कितना होता है? अगर वो 1 मिलियन है ना, तो नेक्स्ट 20 मिनट में वो 2 मिलियन हो जाएंगे विद इन 20 मिनट्स। ओके, हमारे पेट में एनारोब्स है ना, मिलियंस ऑफ एनारोब्स हैं। सो वो कॉन्स्टेंटली एवरी 20 मिनट में अपना पॉपुलेशन डबल करते हैं, है ना। हम जो खाना खा रहे हैं सब कुछ पच रहा है, वो इसलिए क्योंकि वहां पे एनारोब्स है, राइट। सो बैक्टीरिया डिवाइड टू फास्ट, बट कैन यू सी व्हाट इज द डबलिंग टाइम ऑफ दिस बैक्टीरिया? इट इज 11 to 13 days. And what is the temperature they require? 30 degree. So is it possible for Mycobacterium leprae to survive in our body? What is our body temperature? Around 37. So most of the time what will happen, if you are coming into the contact of the Mycobacterium leprae, and if you have a somewhat decent immunity, what will happen? They will not be able to infect you. And not by the infecting, because they themselves will not be able to stay there, so they will die. So most of the people, mostly they do not develop disease. Mostly they do not develop disease. So once, suppose infection comes to my body, okay, 90% there is no infection. But what will happen if they reaches my perineural sheath? So in my peripheral nerves, I have a perineural sheath. This area of our body is slightly cool than rest of the body. Wherever there is blood, it is hot, 37 degree, they cannot survive. But if they reach my nervous tissue, which is a peripheral nerve, suppose this is my radial nerve or a ulnar nerve. In this radial nerve, I have a perineural sheath, peripheral nerve. In this peripheral nerve, suppose I am taking this radial nerve. If this bacteria reaches, then they able to stay. Then they will be able to stay here because this place is slightly cooler. Now you all know, because this bacteria belong to which family? Mycobacterium. How I will kill this bacteria? By forming the granuloma. But suppose this is my first contact. This is the first time I am having the contact with the lepra bacteria, because lepra is not common, no? Lepra is not common. So as soon as this leprosy bacteria come into my contact, my B cell and T cell will recognize that we have a new pathogen. So ये दोनों एक दूसरे से बात करेंगे, क्या बात करेंगे? व्हाट इज द फंक्शन ऑफ बी सेल? It will kill any pathogen by forming the antibody. How the T cell will function? Directly killing करेंगे. तो ये दोनों डिसाइड करेंगे कि अब तू मारेगा कि मैं मारूं, है ना? पैथोजन आ गया, ये क्या सोचेंगे? आइदर यू किल इट और आइदर आई विल किल इट. सो यहां से इंटरमीडिएट लेप्रोसी से दो काम हो सकते हैं. अगर किसी आदमी के टी सेल इम्यूनिटी स्ट्रांग है तो वो चालू करेंगे टी सेल से मारना. दूसरा वेरिएंट है कि किसी के बी सेल ज्यादा एक्टिव है तो वो क्या करेंगे कि भाई मैं बी सेल से मारता हूं. तो यहां पे क्या हो गया? प्लाज्मा एंटीबॉडी हो गई, यहां पे हो गई ट्यूबरकुलर एंटीबॉडी और टी सेल इम्यूनिटी. अब इसमें से अब हम तो जानते हैं ना विच इम्यूनिटी इज बेटर फॉर किलिंग द माइक्रोबैक्टीरिया. ग्रैन्युलोमा किससे बनता है? टी सेल से बनता है ना यार. ग्रैन्युलोमा बनने में टाइम लगता है, ग्रैन्युलोमा स्लोली बनता है ना. तो टाइप 4 हाइपर सेंसिटिविटी क्या है? ट्यूबरकुलर टेस्ट किसमें करते हो? टाइप 4 हाइपर सेंसिटिविटी में कहते हो, है ना? बिकॉज when you have to form the granuloma, it is always delayed hypersensitivity. It will take time, but it will kill effectively. Got my point? So that is why T cell immunity is this is a strong immunity, and this is a weak immunity. This is strong and this is weak. Okay? और यहां पे एक तीसरा वेरिएंट है सबसे जो बीच में है. Okay, sorry, I made a mistake. B cell immunity means it is a LL type. Okay, why LL type? I will tell you. Let me correct here. Plus, this B cell immunity means the type is LL. So, what is the meaning here? It is a lepromatous leprosy. The immunity is a B cell immunity. Immunity is a B cell immunity. Okay. So type is LL. And what is the full form of TT? Tubercular means person is having a excessive tubercular immunity. Okay. And here patient has a T cell immunity. Patient is having a T cell immunity. बीच में एक टाइप है which is a borderline TB. So borderline TB का नाम है BB. borderline. अब यहां पे क्या है? B एंड T दोनों सेम इंटेंसिटी के साथ काम कर रहे हैं. बॉर्डरलाइन में क्या है? दोनों सेम इंटेंसिटी के साथ काम कर रहे हैं. अब इसके बीच में है BT और इसमें है BL. तो इसमें इम्यूनिटी जो है वो T सेल की ज्यादा है और B सेल की कम है. यहाँ पे जो इम्यूनिटी है वो T सेल की कम है और B सेल की ज्यादा है. नाउ टेल मी कहां पे किलिंग ज्यादा होगी बैक्टीरिया की? टीटी और बीटी में ज्यादा होगी. जहां पे ज्यादा किलिंग हो रही है वहां पे किलिंग ऑफ द बैक्टीरिया ज्यादा होगा. सो यहाँ पे किलिंग ऑफ बैक्टीरिया ज्यादा है. तो इफ इन योर एग्जाम इफ दे आस्क यू व्हाट इज द पाउजी बासिलरी डिजीज, पाउजी बैसिलरी कौन से हुए? टीटी हो गया, बीटी हो गया। कहां पे बैक्टीरिया सर्वाइव ज्यादा कर पाएंगे? BL and LL. So if I ask you what is the multibacillary, it is in the BL and LL. इंडिया का नाम क्या है? भारत। तो भारत में कॉमन क्या है? बीटी। सो 3 MCQ याद रखेंगे। मोस्ट कॉमन फॉर्म इन इंडिया इज बीटी। व्हाई मोस्ट कॉमन फॉर्म इन इंडिया इज बीटी? बिकॉज लेप्रा को तो नहीं मारा है, बट उसके भाइयों को तो मारा है ना बहुत। ट्यूबरकुलोसिस इंडिया में प्रोमिनेंट है, तो टी सेल इम्यूनिटी थोड़ी सी स्ट्रॉन्ग है। So what is most common? BT is most common. So what is the test we do? In TB you have a tuberculin test, right? Similarly in leprosy we have a lepromin test. आपका ट्यूबरकुलिन टेस्ट कब पॉजिटिव आता है? मॉन्टुक्स टेस्ट कब पॉजिटिव आता है? आइदर वैक्सीनेशन है या पेशेंट को टीबी हुआ था, मतलब पेशेंट को इम्यूनिटी है, तो आपका मॉन्टुक्स स्ट्रांगली पॉजिटिव आएगा। तो लेप्रोमिन में भी ऐसा ही है कि अगर आपकी टी सेल इम्यूनिटी स्ट्रांग है तो लेप्रोमिन पॉजिटिव आएगा ना। समझ में आ गया? सो लेप्रोमिन टेस्ट अगर मैं पूछूं कि लेप्रोमिन टेस्ट पॉजिटिव तो किस में आएगा? टीटी में आएगा, और बीटी में आ सकता है। लेप्रोमिन पॉजिटिव टीटी और बीटी में आ सकता है। इफ आई से लेप्रोमिन नेगेटिव है तो मेन तो लेप्रोमेटस लेप्रेसी, जहां पे बी सेल इम्यूनिटी यूज हो रही है वहां पे लेप्रोमिन नेगेटिव आएगा। और सेकंड बीएल में भी नेगेटिव आएगा। तो मैं ऐसे भी याद रख सकता हूं कि अगर डिजीज पॉजिटिव बैसिलरी है तो मेरा लेप्रोमिन पॉजिटिव आएगा, और डिजीज इफ मल्टी बैसिलरी है तो मेरा लेप्रोमिन नेगेटिव आएगा। ओके, चलो सपोज करो कि इंडिया का कोई पेशेंट आया है और मैं उसके शरीर से बायोप्सी लूं, तो क्या उस बायोप्सी में बैक्टीरिया मिलेंगे? नहीं। क्यों नहीं मिलेंगे? क्योंकि वो तो हमें उसी जगह से लेना पड़ेगा जहां पे डिजीज है, पूरी बॉडी पे तो नहीं है। अब लेप्रोमेटस लेप्रेसी में क्या होगा? जब डिजीज क्या है? मल्टी बैसिलरी। अब डिजीज मल्टी बैसिलरी है तो बिकॉज ऑफ द मल्टी बैसिलरी डिजीज क्या होगा? दिस बैक्टीरिया विल स्प्रेड थ्रू आउट द बॉडी। अब एलएल में समझ रहे हो? सीरीज इन एलएल में क्या हो रहा है? डिजीज इज अ मल्टी बैसिलरी, इम्यूनिटी इज वीक, बैक्टीरिया इज ऑल ओवर द बॉडी। सो कहीं से भी बायोप्सी ले लो, बैक्टीरिया मिलेंगे। बट व्हाट विल हैपन इन पॉजिटिव बैसिलरी? बायोप्सी पे मिलेंगे नहीं। सो हम ये पॉइंट लिख देंगे कि बायोप्सी में, ऑन बायोप्सी when you take a biopsy in TT and BT, you will see that no organism. Why? Because you will have a localized lesion. What you will have? You will have a localized lesion on biopsy. And here in BL and LL, many organisms present on the body. Many organism is present on the body. सो बायोप्सी क्या आएगी, रिजल्ट पॉजिटिव आएगा. बायोप्सी विल हैव अ पॉजिटिव. एलएल वाला ज्यादा सिवियर, एलएल वाला इसलिए तो फोटो दिखाई ना. और एलएल की फोटो सिवियर होगी. टीटी में क्या होगा, पेशेंट की कोई नर्व ठीक हो गई होगी. तो हम ये देखते हैं. तो चलो अब एग्जांपल लेते हैं. अब आप समझ गए कि विच इज स्ट्रॉन्ग विच इज वीक, है ना. चलो सपोज करो मैं सोच रहा हूँ कि इस दिसंबर में मैं एग्जाम दे दूंगा आप लोगों की एमसीआई, है ना. सॉरी, अरे एग्जाम्पल है, लेट्स टेक एन एग्जाम्पल. तो उसमें मुझे सारे सर ने आके बताया कि या so what I am saying is the teachers told me that go with this 5 subject: medicine, surgery, obs-gyne, pedia, optha, and the basic subject, and do this 11 subject and you will pass. Right? It's example, okay? Take it as an example. You will pass. So what I did this subject thoroughly. I went for the exam. Though whatever the sir told me is a right, because it covers almost around 200 questions, right? But suppose I didn't pass. Actually, I should pass, but actually I didn't pass. So what I will do, I will consider that the advice was given to me is wrong. Now I should be focusing more on the short subjects only, which is now I will not rely on this subject. ये pass नहीं कराता. This doesn't make me pass. So what I will do, I will take a very bad idea of doing only the short subjects in the next exam, right? So similarly, what happens with our immune system? Though T immunity is a very strong immunity, right? But एक example लेते हैं. This is my radial nerve. In this radial nerve, as I told, these are the bacilli. In TT bacilli, if I have a strong TT bacilli, what I will do? I will form the granuloma, right? T cell immunity causes granuloma. But by forming the granuloma, what I did? I made the compression of the radial nerve. So I developed the radial nerve palsy. T cell immunity ने क्या कर दिया? मेरी radial nerve की palsy कर दी. Why? Because granuloma बना ना. हमने देखा था TB का the wart of the TB was large, right? If it is a exogenous, so this is the lepra which is on my nerve. So what it will cause? It will cause palsy. It will cause the radial nerve palsy. But if this granuloma is seeing that even after forming the granuloma, I am not able to kill this bacilli. So it will try to kill for months and months. But as I told, if inside the granuloma, this immunity is not able to kill this bacilli, now this T cell will call their friend, B cell, please come. This is not my work. I am not able to kill them. So what the B cell will do? B cell will take it as a message that okay, so it should be my work. Because if you are not able to work, I should be able to kill this bacteria. So what they will do, T cell will now start dissolving this granuloma and start calling the B cell. But as a doctor, we know their interaction is wrong. So what will happen? Once they open this granuloma, this bacteria will come out. And because they are now large in number, what will happen? They will start going into the body. Now what T cell is thinking? That I don't have to kill this bacteria, B cell will kill. B cell will keep trying. But what will happen? Bacteria will increase in number again and again and again. So a person who had started this disease by killing with the T cell immunity will land up into the which? LL. So disease which was controlled will worsen, right? So we will write this. What will happen without treatment? And second thing, first of all, let's let's take an example. If this patient is coming to you at the stage of the palsy, when the granuloma is formed, ऐसा करते हैं, सेम एग्जांपल लेते हैं. I am going for your MCA exam, and in that exam, all the 300 questions came from that subject only, which sir told me. There was only 20 marks question which I didn't study. So I got the 200 plus mark in MCA exam. Now I will be spreading the wrong message also, that do this 12 subject, you will pass. So this is a wrong assumption I took. So similarly, what happened when this patient is coming to me? I gave them a drug which is a rifampicin. I diagnosed this person as a doctor, and I gave a drug rifampicin. So what is the function of rifampicin? To kill the mycobacterium. So my drug get inside this granuloma and killed this bacteria. But T cell don't know that drug is working. What the T cell is thinking? I killed. What he thought? That I killed. So what will happen in our body, wherever? So T cell is also telling other T cell that start forming more granuloma. Bacteria are dying. So what will happen? Whatever the palsy the patient had, it will get worsened because now the immunity will form very large granuloma. And wherever in the body, so first of all, this patient had only a radial palsy. But as soon as the message reaches the ulnar nerve, so any few bacteria is on the ulnar nerve, it will start forming the granuloma around the ulnar nerve also. So similarly, like this, all my hand now, median now, ulnar now, radial now, wherever I see the bacteria, I will form the granuloma and I will cause the palsy. So this is known as a Lepra reaction. So what is a Lepra reaction? Unnecessarily immune system is active because of doctor's treatment. So at this time, what I will do, I will give this patient rifampicin also, and I will give this patient steroid also. So by giving the steroid, I am telling the immune cell that you stay calm. Now rifampicin will work. Okay. So this is the whole story of the leprosy. So let's write. Without leprosy treatment, without a treatment means you haven't given the treatment yet. Means you haven't given the treatment yet. So what is the takeaway? PT has the best immunity. PT has the best immunity. LL has a poor immunity. PT has the best immunity. LL has a poor immunity. So if the patient started from this without a treatment, what will happen? A downgrading reaction. A downgrading reaction will occur. If PT is not able to kill the bacilli, is not able to kill the bacilli. So which is the most stable form? Either if the patients have a TT, this is the most stable, and LL, this is also the most stable. Why? Because they are not confused. They are using only one type of immunity, B cell or T cell. They are not confused. So most stable is a TT and BT. Why? Because they have decided that we will use only this immunity, B cell and T cell, which is most unstable. The most unstable is a BP. Why? Because they do not know which to use, B cell or T cell, right? Okay, B cell and T cell. Most unstable is a BB. So these all are the MCQ points, okay? These all are the MCQ points, most stable, most unstable, right? Now, let's take these two patients with the treatment. So see this, if this patient is coming to me for the treatment, okay? Suppose a TT patient is coming to me for the treatment. I will give the treatment, and which type of hypersensitivity will increase? Type 4, right? In the TT stage, if the patient is coming with the TT leprosy, so when I give rifampicin, there will be increase in the type 4 hypersensitivity reaction. Why? क्या बनाना है? ग्रेन्युलोमा तो बनाना है ना? So ग्रेन्युलोमा बनाना है, type 4 hypersensitivity reaction है. So in type 4 hypersensitivity reaction, it is a type 1 lepra reaction. So ये MCQ, the MCQ they ask is, which type of hypersensitivity reaction you see in the type 1 lepra reaction? Answer is the type 4. Let's take an example. If I give a treatment to a patient of lepromatous leprosy, and if now what they will think, lepromatous leprosy patient's immunity will think that B cell is my way. So what immunity will increase? It is a type 3 hypersensitivity, because antibody immune complex will form. It is a type 3 hypersensitivity reaction, and this is known as a type 2 lepra reaction. एग्जाम में याद रखने के लिए मैं ये कहूंगा कि सबका जो टोटल है ना दोनों का 5 होना चाहिए. So type 1 lepra reaction, type 4 hypersensitivity, type 2 lepra reaction, type 3 hypersensitivity. ओके, सो ये है ना बेसिक अंडरस्टैंडिंग है. और लेप्रोसी की कुछ वन लाइनर्स जब मैं आपको ये पीडीएफ दूंगा, अब मैं इसके डिटेल में ज्यादा नहीं जाऊंगा, बट अगर आपने बड़ा बड़ा ये समझ लिया है तो आफ्टर दिस यू हैव टू गो थ्रू इंपॉर्टेंट वन लाइनर्स. ओके, अभी मैं फॉर द टाइम बीइंग अभी मैं नहीं जा रहा हूँ, बट हमने डिस्कस कर लिया है. आपको अब इतना बेसिक आइडिया आ गया तो इसके ऊपर सब कुछ याद रह जाएगा. ठीक है, खाली एक ट्रीटमेंट लिख दीजिए. व्हाट आर द ड्रग ऑफ चॉइसेस? ड्रग ऑफ चॉइसेस इन लेप्रोसी. ड्रग ऑफ चॉइस इन लेप्रोसी पूरा याद रखने की जरूरत नहीं है. द ड्रग यू हैव टू रिमेंबर, रिफाम्पिसिन, क्लोफाजिमिन एंड डेप्सोन. दीज आर द 3 ड्रग्स आर यूज्ड. खाली नाम लिखना है, पूरा लिखने की जरूरत नहीं है. हाँ, तीनों देनी है, तीनों. पर खाली इतना याद रखना, ये मत भूलना कि बिकॉज ये दवाइयां क्या देनी है, वंस अ मंथ देनी है. ओके, दिस मेडिसिन आर गिवन ओनली वंस अ मंथ, बिकॉज बैक्टीरिया का डिवीजन बहुत ही स्लो होता है. ओके, डिवीजन ऑफ बैक्टीरिया इज टू मच स्लो. You just have to remember these medicine are once a month only. These medicine are given once a month only. हाँ डेप्सोन डेली देनी, डेप्सोन और तभी देनी है लेप्रा रिएक्शन में देनी, जब पेशेंट को लेप्रा बैठ जाए, जैसे ही लेप्रा रिएक्शन खत्म हो जाता है कंटिन्यूएशन करना है 12 महीने तक। पेशेंट मल्टीबैसिलरी में है या पॉजिबैसिलरी में, तभी ये दिया। ओके, एक्ने की हमें खाली पैथोजेनेसिस समझनी है और फिर ट्रीटमेंट लिखनी है। सी दिस इन एक्ने, write down acne. So you can leave one page for the important one-liners in leprosy. Just leave one page. When I will give you the PDF, you can write down that important one-liner in that page. From the new page, start acne. Slide. वो ट्रीटमेंट की बच्चे पूछ रहे थे। Please English में। Okay. So what do you want me to repeat? Okay, I will take your queries after this topic. Okay, so first of all, what we will see in acne is which gland is involved in acne? Pilosebaceous. So just write down in acne, sebaceous gland. In acne, which gland is involved? So just we will write the treatment because the most of the MCQ is being asked on the treatment only. So this gland involves which is the pilosebaceous unit. So I will show you the photograph of it. So see this. What is the pathogenesis of acne? So this is the pilosebaceous gland. In this pilosebaceous gland, when then it is getting obstructed, as you can see, there is a hyperkeratinization. When there is a hyperkeratinization obstruction, now what will happen? This gland will secrete all its sebum. Generally, this sebum should get excrete from this hair follicle, right? It should go out from the hair follicle like this. But what is happening because of the obstruction? What will happen? There will be an increased sebum in this area. So on our skin, we have a bacteria which is a propionibacterium acne. Generally, this propionibacterium acne eats sebum. What is their diet? Their diet is the sebum. So when we have a obstruction, what will happen? This sebum will not go out, right? So what this bacteria will do? This bacteria will migrate deeper into our skin to eat up this sebum, right? Once they come into our skin, what our immune cell will do? Immune cell will try to attack propionibacterium acne, and once they are attacking, what will happen to our body? There will be the inflammation. What will the inflammation? Patient will now develop the papule, right? And if the pus is formed, patient will develop a pustule, and if this papule gets larger, now it will be the nodule. What is this obstruction? This obstruction is known as in a common term, it is known as a comedon. But in comedon, there is no inflammation. If you see this, when I have a obstruction of this, there is only a comedon. When this come into the contact, it will turn black. So comedon, you know, it can be the whitish color, it can be the blackish color. So no one is going to ask you MCQ on what is a comedone and everything. What we have to know in acne, if I see a patient of acne in a one face only, there will be the some keratin obstruction. So in the same patient, if I see on the forehead, he has some comedone. I will see blackish spot. Okay. After this, I can see the nodule or the papules. And if there is a pus, then I can see there is some other pustule. So you all know, you have went through this, right? You have seen the faces with the acne. In acne patient, you will see all these lesions. But how to treat this condition? So write down what we will do. We will write down the treatment in a, starting from the non-inflammatory to the inflammatory. So what is the comedonal acne? Comedonal acne means keratin obstruction. It is a keratin obstruction of the pilosebaceous gland. It is a keratin obstruction of the pilosebaceous gland. Keratin obstruction of the pilo. So I will give keratolytic drug. So which drug are used? We can use adapalene or a tretinoin cream. So it will help me as a keratolytic. It will remove the obstruction. Sorry? सैलिसिलिक एसिड पे केराटिन वो तो सारी हटा देगा, हमें तो खाली केराटिन ऑब्स्ट्रक्शन हटाना। सैलिसिलिक एसिड तो पूरी नॉर्मल स्किन भी हटा देगा, एक्सटेंसिव केराटोलाइसिस करेगा। केराटोलाइटिक, एडेपिलिन एंड द ट्रेटिनोइन। किसमें? वाट्स के ऊपर ही लगा है, टॉपिकली लगा है। ओके, मेनली द पैपुलर, so we will continue with the topical retinoid. And because there is a papule, what I will do, I will give topical antibiotic. Because at this stage there is a increase in the Propionibacterium acne. Which topical antibiotic we use? Topical we use clindamycin. Topically we use clindamycin. Okay. And when there is a development of the pustules, so pustules means pus, right? So we will continue all this medicine, but we have to add oral antibiotic. We have to add oral antibiotics. Sorry? Add करना. Oral antibiotic, but for some period of time we will start this. Along with, we can add one important drug, which is a benzyl peroxide. So if you are giving this medicine, what is the advantage of this? It is having a two property of keratolytic. It is a keratolytic, and it is also bactericidal. So what you have to understand is, if you are using benzyl peroxide, you can take out topical retinoid and topical antibiotic, right? This medicine you can avoid, keratolytic and bactericidal. ओरल एंटीबायोटिक्स हम देते हैं एजिथ्रोमाइसिन, डॉक्सी एंड द मिनोसाइक्लिन, एजिथ्रोडॉक्सी एंड मिनोसाइक्लिन. Okay, oral antibiotic. This MCQ was asked, what is the drug of choice for the nodulocystic acne? Drug of choice for the nodulocystic acne is a isotretinoin. Drug of choice is a isotretinoin. Okay, acne in pregnancy. Generally, the drug of choice is a topical. Benzyl peroxide is the treatment of choice because of the two properties, as we already discussed. Topical benzyl peroxide is a treatment of choice. They ask this MCQ, what is the side effect of the isotretinoin? What is the side effect of the isotretinoin? It is a dry lips. Dry lips is most common. Second is a dyslipidemia. Dyslipidemia. And this drug is a teratogenic. This teratogenic remains 4 weeks after stopping the drug. 4 weeks after the stopping the drug, the teratogenicity will remain. Okay. Okay. See this rosacea. In rosacea, what they will give you, a female will give a history that after taking spicy food, alcohol and sun exposure, I develop this pink redness. So as soon as we go out in the sun or having a spicy food or alcohol, the rash will increase. So do not get it confused with a butterfly rash of the SLE. The butterfly rash of the SLE will not change with the diet and everything, right? So the other difference is a nasolabial fold. What you will see, that nasolabial fold is involved. So this is the difference between the malar rash and the rosacea. So what is the rosacea? Facial flushing plus trigger. You will see the trigger factor, which is a sun, spicy food and alcohol. Sun, spicy food and alcohol. Patient has an increased demodex mite. Increased demodex mite on the face. This patient has an increased demodex mite on the face. On a long term, this patient will develop this complication, which is a rhinophyma. Okay, so the long term complication is a rhinophyma. is due to sebaceous hyperplasia. It is due to sebaceous hyperplasia. It is due to sebaceous hyperplasia. ओके, हम दो पैरासाइटिक डिजीज के बारे में खाली लिखना है. अरे 4:30 तक बोला मैंने. हाँ क्या स्केबीज की ट्रीटमेंट लिख लो, जरूरी है, एग्जाम में क्वेश्चन आते हैं. स्केबीज only treatment is important. Many MCQ has been asked on this. What is the causative agent? Sarcoptes scabies, right? Pathognomic finding is a burrow. Burrow is a classical pathognomic finding. Burrow is a classical pathognomic finding. It is a type 4 hypersensitivity reaction. Most common symptom is a night time itching. Most common complaint is a night time itching. For the treatment, permethrin single neck to toe. So what you will do? Neck to toe application. Permethrin single neck to toe application. Okay, so do not get confused. In pregnancy we use the same treatment. Okay, if they ask treatment of scabies in pregnancy, answer will be the same. It is safe in pregnancy. It is safe in pregnancy. पेडिकुलोसिस किससे होता है? It is caused by the lice. It is caused by the lice. खाली इसमें याद रखना है, ट्रीटमेंट is also the same. Treatment is same. The permethrin. ओरल आइवरमेक्टिन. अगर ऐसा पूछते हैं कि which oral drug can be effective, दोनों में ओरल ड्रग. If drug effective कौन सा है? Treatment of choice is always the permethrin. But if they ask which oral drug can be useful, okay, which drug can be useful, then it is a ivermectin. Then it is a ivermectin. So that is it for today. So how many days you need to read these notes? No, in total, effectively. So what my plan is, take 10 days. I know you have a busy schedule. Go through these notes. I will tell Mahesh to conduct one exam. I need your 2.5 hours more. So what I want is your subject is ready. In this, what 15 days enough? 15 days enough. So what I want in this 15 days, I will be sharing some photos, these files, You go through this, and then I will have a 50 MCQ exam. Okay, and we will discuss that MCQ. So whatever is lacking, we will refurbish this knowledge in a good way. But promise me in 15 days you will go through this. So what I want, when you have only 1 month left, your this dermatology subject is ready. So my subjects for which I want is the pediatric and the dermatology. So I